When it comes to tackling the coronavirus, there's no party politics in this, no partisan issues.
I can remember during the election, I was having a right old go at you for promising to spend 500 billion, and yet now we have a Conservative Chancellor wanting to spend 600 billion. How does that make you feel, John McDonnell?
Let's get the figures right first. There's a bit of spin on this. 500 billion was already committed. So from what I hear, the independent calculations are basically saying this is about 91 billion extra. So we need to calm down about it all. It certainly wasn't on the scale that we were envisaging. And the issue for me now is, well, have we really won the argument with the Tories, and are they now willing to invest? Are they willing to make sure that we have investment not just in infrastructure but in our public service, etc.? Well, I think we've pushed them along. There's no doubt about it. We've changed the weather a bit, and they're having to address these issues. But remember, it's after 10 years of austerity, and if you look at what they've done in terms of infrastructure investment in particular, they created a £192 billion hole by cutting back on infrastructure investment. So even if they bring forward £91 billion additional expenditure, it's only filling about half the hole that they actually created. So this is not revolutionary. Let's not dance in the streets or anything like that. And in addition to that, nothing at all, I'm afraid, in terms of tackling some of the crises that we've got in our public services. And one of the lessons I think that we've got to learn, particularly as we tried to tackle the outbreak of coronavirus, is that if you do starve your public services of resources when you need them, unfortunately they're depleted, and in some instances like social care actually in crisis already. So there's lessons to be learnt from all of this issue of 10 years of austerity and its implications.
He has said that the NHS will get whatever it needs to get through the coronavirus crisis.
And so let's be absolutely clear, and people should be assured of this. When it comes to tackling the coronavirus, there's no party politics in this, no partisan issues. We'll work with the government on this. There are issues that have to be addressed. There's gaps in the coverage today, but we'll try and work with the government to complete those gaps. Support for self-employed people, support for zero-hour contract workers, low-paid and part-time workers is not there. And in addition to that, the level of support, statutory sick pay at £94, is clearly not enough to support people. But we think with working with the government, we can overcome that. So when it comes to coronavirus, we'll support them. The issue in additional revenue expenditure of the NHS will support, and we agree if the NHS has to come back and it needs more, it will have it. We've got to tackle this issue of social care, and it's interesting, Jeremy Hunt, former Health Secretary, raised this issue today and was a bit surprised, like we were, that social care hasn't been addressed, because these are, social care, it looks after the elderly and disabled people, and these are the people most vulnerable to coronavirus. So hopefully we'll be able to work with the government and overcome that problem.
Just before we came on air at 7, Matt Hancock, the Health Secretary, is making a statement in the House of Commons. He said there's going to be emergency legislation coming next week. He's going to be holding discussions with the Labour Party on the contents of that legislation. I mean, you sound as if you're probably minded to support what he wants to do.
We are already in some of the discussions taking place. Jonathan Ashworth, I think, on our behalf, has played a tremendous role. We've been having separate briefings, obviously, under Privy Council Rules 2. So we'll do everything we possibly can to work together. And we've got to assure people we'll meet this crisis, we'll meet coronavirus outbreak head on, and we'll overcome it. And we'll overcome it by working together as a country.
John Ashworth has said today, your Shadow Health Secretary, that there are some in the medical community that think we're placing too much emphasis on behavioural science and that our approach may be differing too much from other European countries. There is a massive contrast between the way we're handling this and other European countries. Are you at all uneasy about that?
My view on all of this is just follow the experts. The Chief Medical Officer and Chief Scientific Officers have been excellent throughout. I just think you need to follow the expert advice on all of this, and you do take into account, of course, cultural issues, of course you do. But my view, I'm a politician. I have not studied in terms of incidents of conditions like this. I'm not the expert. Listen to the experts and we'll follow their advice. And so far that seems to be working, but we're nowhere near the peak of this outbreak, and the worry is You know, there's a lot of human suffering to come, and other people have died today, unfortunately.
And when you were sitting there listening to the Chancellor today, were you at all thinking that could have been me?
Oh, yeah, of course I was. Of course I was. I just wish we'd won the election, because it would have been a much better budget. We would have had a much longer-term plan for our infrastructure investment, but I would have ended austerity. You know, you mentioned earlier, one of your commentators said ended austerity. No, it hasn't. What it's done on the calculations for the expenditure in the next year is additional £19 billion revenue. The IFS, Institute of Fiscal Studies, so if you want to end austerity today, you need to spend £54 billion to get back to 2010 levels of expenditure per head. So we haven't ended austerity. Austerity continues on. Lots of people are still suffering out there. And the infrastructure spend, again, it annoyed me a bit that the government actually put off the publication of the infrastructure plan as well. Even the infrastructure, it looks as though it's going to be delayed in its implementation. So, no, frustrated, of course, I was today, but you know, what we're going to try and do is work with the government, tackle coronavirus, but then in terms of the longer-term planning of the tackling the crises in our public services, investment in our infrastructure to turn our economy around, we'll, as an opposition, will be campaigning and putting our ideas forward. And, you know, you never know. We've pushed them back a bit on this today. We might be able to push them back a bit further.